the anti-drug vaccine that excited scientists. Brazilian vaccine against crack and cocaine addiction is gaining international recognition, competing for a significant award. Today's video explores the importance of this vaccine for society as a whole, not limited to drug users. The central issue is understanding the biology behind chemical dependence in the brain and how it was possible to develop a vaccine capable of addressing the disorder of drug use. We will learn about John's story, a 35-year-old man passionate about music working as a DJ. His life was going well until his nighttime and weekend jobs started causing problems in his relationship with his wife. After many years of arguments, John faced a relationship breakup, giving up everything that brought him pleasure, including his nighttime performances, even when job opportunities were available. Deeply saddened, John, in a moment of vulnerability, made the worst decision of his life. He started using crack, the solid form of cocaine known to cause dependence and addiction. It's worth noting that, although personal use has been decriminalized in the state of Oregon, the sales and dispensaries of cocaine are still illegal due to the extremely severe impacts on users' health and social life. The featured vaccine emerges as a promising hope to address this issue and provide an effective approach in treating addiction to such harmful substances. John's story serves as an educational warning, highlighting why no one should get involved with drugs. What began as an escape from sadness quickly turned into compulsive behavior within months. Feeling a growing need for drugs, John found himself in a situation where his money wasn't enough to sustain his uncontrollable urge, especially without a job. Desperate, John sold household furniture and borrowed money from friends but never managed to repay. Despite being aware of the harm he was causing, whenever he tried to reduce use, he experienced chills, fever, and a terrible sense of anxiety and nausea, classic withdrawal symptoms. The substance use disorder is recognized as a serious public and personal health issue. The severity of this challenge is so significant that combating substance abuse is part of one of the 17 Sustainable Development Goals of the United Nations. United Nations data reveals that, in 2021, at least 18 million people around the world used cocaine or crack. In the United States, in 2021, approximately 1.4 million individuals aged 12 and older had a cocaine use disorder, resulting in around 24,486 cocaine overdose deaths. These numbers underscore the urgency of addressing and effectively tackling this global health crisis. The 2021 National Survey on Drug Use and Health, NSDUH, report reveals that approximately 1.7% of the United States population, equivalent to about 4.8 million individuals aged 12 and older, reported using cocaine in the past 12 months. In the face of this scenario, it is crucial to understand that both cocaine and crack have the ability to alter self-control circuits in the brain, leading to a compulsive drug-seeking behavior and neglecting other vital activities. This reality highlights that the problem cannot be ignored, as it impacts not only the life of the addicted person, but also that of their family and society as a whole. John, as an example, needed to be admitted to a rehabilitation clinic, facing numerous relapse episodes, a common situation in such treatments. John's recovery process took 6 years until he finally managed to break free from the disease, during which he witnessed several stories without a happy ending. Faced with this context, the question arises about how cocaine and crack can become such debilitating addictions. How can a substance originating from a plant generate such intense, pleasurable sensations to the point of turning into a disorder? These questions prompt a deeper understanding of the complexity involved in the development and treatment of drug addiction. Archaeologists suggest that around 3000 before Christ, in the regions of the Peruvian Andes, Bolivia, and Colombia, coca leaves were chewed by natives. They noticed that something in those leaves caused a stimulating sensation, helping to overcome the effects of the mountainous altitude. However, it was only in 1859 that the substance known as cocaine was isolated in a laboratory in Germany. While laboratory-extracted cocaine takes the form of a crystalline powder, crack is produced from the reaction of this powder with chemicals, forming rocks that are heated and smoked. Although they have this difference in presentation, essentially, crack and cocaine share the same active ingredient, the substance cocaine. Upon entering the bloodstream and reaching the brain, cocaine encounters a crucial protective barrier called the blood-brain barrier. This barrier functions to prevent the entry of microorganisms and harmful substances into the body's most vital organ. However, cocaine has a unique ability. Being a small molecule, it can cross this barrier. It is in the neurons of the brain that cocaine exerts its effects. Neurons communicate with each other through molecules called neurotransmitters, revealing the complexity of the impact of this substance on the central nervous system. The drug alters the dynamics of neuronal communication, especially when it comes to dopamine, the primary neurotransmitter associated with the sensation of pleasure. Under normal circumstances of pleasurable stimulation, such as eating something tasty, receiving a reward, or even during sexual activity, dopamine is released. Neurons emit dopamine to others in a region called the synapse. However, after some time, dopamine is removed from the synapse through transporter proteins, establishing a temporal limit for the stimulus. Cocaine intervenes by blocking these transporters, allowing dopamine to remain in the synapse for a significantly longer time than usual. This amplifies the intensity and prolongs the duration of any minimally pleasurable stimulus, resulting initially in a feeling of euphoria. Additionally, the drug affects other neurotransmitters associated with the sensation of alertness that users experience. However, this effect is fleeting, lasting approximately 15 minutes to 1 hour. Soon after the drug is eliminated from the brain, dopamine and other neurotransmitters are rapidly removed from the synapses and take time to be produced again. This explains why the euphoria caused by these substances is temporary, quickly followed by feelings of sadness and anxiety. Interfering with the natural processes of the central nervous system results in a cycle of intensity and decline, contributing to the challenges associated with the use of these drugs. If crack and cocaine generate negative feelings, such as sadness after a period of euphoria, the question arises, how do people, like John, become dependent on them? What is the root of addiction? It is important to distinguish between addiction and dependence because, although they may seem similar, they are not the same thing. Addiction is considered a mental disorder in which the brain's self-control systems are altered, and it can occur even without the use of substances. For example, the American Psychiatric Association currently recognizes gaming addiction as a disorder, while the World Health Organization, WHO, also considers gaming addiction. The debate continues on whether the uncontrolled pursuit of social media, pornography, sex, and even physical exercise would be classified as addiction. The idea of a series on addictions is being considered, with potential themes such as the possible dependence on caffeine and sugar. The fact is that addiction is a compulsive behavior related to the brain's reward system, primarily coordinated by dopamine. Understanding these mechanisms is crucial to grasp the complexity of addiction and develop effective prevention and treatment strategies. The intense release of dopamine during addictive activities causes brain modifications to the extent that just thinking about using a drug result in an anticipatory dopamine release even before consumption. Dopamine, which controls motivation, creates an almost uncontrollable urge to seek the substance or pleasurable activity. This intense motivation for the reward can suppress the desire for other everyday activities. At this stage, we can say that the person is sick, addicted. They cease to perform common daily activities, such as working and socializing, reaching the point of putting their own life at risk to obtain the desired reward. An addicted person is someone who has developed a disorder due to the use of a substance that directly affects the reward system, self-control, and motivation. While no one fails to fulfill daily responsibilities for not having had coffee, it is entirely possible for a cocaine addict to expose themselves to life-threatening risks while seeking the substance through trafficking. This contrast highlights the seriousness of addiction, which goes beyond a conscious choice and involves profound alterations in the brain's functioning. And there's a detail that further exacerbates the situation when addiction occurs due to the use of certain substances that stimulate dependence. But what is the difference between dependence and addiction? When John became addicted to cocaine, he realized that he needed increasingly larger amounts of the drug to experience the same pleasure. This happens because some substances, including cocaine, stimulate a biochemical phenomenon called tolerance, making the body and brain more resistant to the drug's action. Not everyone who uses drugs develops dependence, but factors such as genetics, family history, and stressful childhood situations can increase the risk of this disorder. A person with dependence, in addition to needing increasing doses to achieve the same effect, when trying to get rid of the drug, faces withdrawal, a syndrome that includes irritability, anxiety, and more severe physical symptoms such as fever, tremors, and even urinary incontinence. It's as if the body, quite literally, is pleading for the user to return to substance use, making treatment challenging and prone to relapses. A significant issue arises. Attempting to quit using the drug is risky, as the user goes back to the dose they were accustomed to consuming before trying to stop, when their tolerance was at its peak. This cycle greatly complicates treatment and increases the likelihood of relapses, highlighting the complexity of addiction and dependence. In these situations, there is a high risk of surpassing the body's limits, resulting in a potentially fatal overdose. For all these reasons, the phenomenon of dependence and addiction is considered a mental disorder due to substance use, an illness rather than a choice. The affected person has their life drastically impaired, unable to work, impacting the lives of everyone around them. Therefore, substance use disorder is a public health problem that affects everyone, even those who do not use drugs. Given this scenario, how can this situation be resolved? Brazilian researchers have taken a giant step in combating drug abuse through a vaccine. In addition to therapies with mental health professionals, there are self-help groups and organizations that provide support to drug users. There are also medications for addiction and remedies that can prevent withdrawal crises. So far, no medication has been specifically approved for cocaine or crack dependence, but this reality began to change with a major announcement in 2023. This integrated approach, involving various methods, seeks to provide more effective solutions to address the complex challenge of substance dependence. A vaccine against dependence, developed by Brazilian researchers, aims to teach the immune system to attack drugs. The starting point was the observation that heavy cocaine users had circulating antibodies against the drug in their blood. This discovery led to the intriguing question: could it be possible to generate an immune response against the drug to neutralize its effects? In contrast to conventional vaccines, which typically aim to generate antibodies to combat foreign organisms, in this case, the foreign organism is the drug itself. Various research groups around the world have produced molecules that mimic cocaine and linked them to proteins capable of stimulating the immune response, resulting in several vaccine candidates. In this scenario, a group from the Federal University of Minas Gerais achieved promising results in 2023. Mice that received the Calixcoca vaccine produced antibodies that bind to cocaine. What's most interesting is that this binding makes the cocaine molecule too large to cross the blood-brain barrier. In this way, the drug has reduced entry into the brain, causing fewer effects. Furthermore, the vaccine also protected the mouse pups from the effects of cocaine, which is crucial because the drug can pass through the placenta. But this passage seems to be less effective when it is bound to antibodies. This innovative approach paves the way for a potential solution to the treatment of chemical dependence, representing a significant advance in the search for effective therapies. In practice, scientists believe that in the future, people who take this vaccine may be able to avoid the effects of the drug, contributing to both the prevention and treatment of dependence and addiction. With promising results in animals, FAPEMIG, the State Research Support Agency of Minas Gerais, will invest 10 million reais in clinical trials in humans. This could be the milestone in the creation of the first cocaine vaccine, representing a significant step in resolving this disorder. This development is incredible, a scientific solution to an extremely complex problem.